Bronchial asthma. It is a chronic inflammatory, lifelong or life-lasting disease of the human body. It is the disease of upper respiratory tract and it is incurable but can be managed. The symptoms can be decreased and the patient can get relief by the use of current medicines and the devices and the various surgical procedures can be employed to eliminate or to mitigate the distress and the symptoms of the disease. The main symptoms are cough, chest pain, breathlessness, tachypnea, dyspnea. There is hardness in inhalation and especially exhalation because the exhalation process is very troublesome as due to swelling and edema of the inner lining of the airways, the bronchus and bronchioles, due to the reaction of the immune system to the various triggers. Triggers are the articles or the factors that stimulate the reaction of the immune system of the human body, which attack them and try to destroy them or to eliminate them, destroy them. But in this fight, if the allergens, which may be animated or inanimated, they are powerful one, so there is production of inflammation. And this inflammation become from acute to chronic as the period of the disease is prolonged or progressive one. So this acute asthma can be converted into chronic asthma if it is not initially or promptly diagnosed and treated. So early treatment can check the advance of the asthma disease and the trouble or the symptoms, agonizing symptoms of the patient. The age of onset is usually at the childhood, but it can occur at any stage. So mainly it is present in men or the male genders, especially the younger ones or the old age who are the addict to the tobacco smoking. So tobacco smoking is the main factor for the production of this asthma disease. So other etiological factors, they are genetic, the familiar predisposition. There are particular genes which are responsible for production of these genes. Second is the atmospheric or the environmental or the lifestyle of the patient or occupation of the patient and the surroundings, disturbances, the sensory conditions. In this, there are irritants and allergens, which we call the triggering factors. They stimulate or instigate the bouts of the attacks of the asthma. So asthma is a disease which occurs in attacks, exacerbation or bouts, episodes form. So then the main factor is the allergens, pollens, pollens of the trees, weeds, flowers, especially in spring season when it is also produces the hay fever. So constant attack of hay fevers or seasonal rhinitis may lead to the production of may be responsible in the production of the asthma attack. Then there are mites, ticks, pets, denders, So these dust, perfumes, various chemicals produced in various factories, person working as a profession in the various chemical producing factories, the fumes of those chemicals, they are the irritant ones. They produces inflammation in the the airways, that produces inflammation and the swelling and obstruction in exhalation of the air. Then there is the drug induced asthma. Drugs, especially the beta blockers, aspirin, NSAIDs, they are the mostly responsible for drug induced asthma. Over activity, I mean the exercise or the manual work, that may also act as a trigger factor. Stress, depression, these they are also the trigger factors ones. Certain foods, they produce allergic reaction of the asthma, that is milk, fish, eggs, etc. These are the various seeds, oils, they can produce, the as a trigger factor for the production of the episodes of the asthma. So asthma, initially it is acute and it is converted after a prolonged duration if not treated into chronic form. And chronic form is further, according to the severity of the episode, is further divided into mild, moderate, into the severe ones. Severity one. The difference between the COPDs and the asthma is that asthma usually starts in the early stage, that is in the childhood, whereas the COPD, they are the diseases, the onset is in the elder or the aged ones. After 40 years age. The, especially those factors, who are the tobacco smokers and the working, the industrial one or professional person working in the unhygienic atmosphere, or the, the where there is fumes, dust, odors. These are the irritants produced and inhaled for it for 1 or 2 decades. They then produce the respiratory diseases. So COPD is not a upper respiratory tract infection, but it is also affect the alveoli system. It includes chronic bronchitis, bronchiectasis, emphysema. So these are upper come. The lower respiratory tract, that is the alveolar system, is also involved in COPD. Whereas the asthma is exclusively, it is the narrowing of the airways, that is the inner lining of the bronchi, bronchioles. These are the air or the windpipes. They are responsible for the production of this disease, asthma. There is narrowing of the lumen of the airways. So due to which there is obstruction in exhalation and the inhalation of the air. So these are the various etiological factors, symptoms, and now we come to the diagnosis. That is, the symptoms of the patient is enough for diagnosis of the asthma. Early onset, then there is wheezing, there is tightness of the chest, hardness in the respiration, dyspnea, there is restlessness, palpitation, tightness of the chest, pain in the chest. These are the main symptoms which the patient is suffering one. For early diagnosis, the symptom of the patient and the examination, physical examination is enough for the provisional diagnosis of the asthma. Now, serial of the X-rays of the chest are performed. CT scan is also helpful for detailed studies of the inner, the lining of the airways, inflammatory intensity, where there is obstruction, there is plugging of the mucus material, we can can observe from the CT scan detailed study of the upper respiratory tract. That is the spirometry. By this, this is a device by which we can judge the volume of the air exhaled by the patient and the rate of the patient, or the position capacity of the patient to the speed by which he can inhale the air. Then it is a test of the inhalation, exhalation. I'm sorry, exhalation. And we judge the volume and the speed of the exhalation, the air exhaled by the patient, that is judged and estimated and observed by this spirometry process. Then comes the peak flow rate. Peak flow is also, there is a device by which we can also observe by the volume and the force and the hardness of the patient in exhalation of the breath, uh, exhalation of the breath. So these are the two main, the devices which we use to observe the patient capacity in volume and the force uh, and the speed by which he can exhale the air after taking a deep breath. So these two devices, they are used to check the capacity of the patient and the hardness of the patient in exhalation. Next is the allergy test. Various allergic solutions, they are, I mean, in the form of small pockets or bags, they are attached to the back of the chest, and then we, detect the various allergens by uh, which are producing sensitivity in the patient. Then we come the blood test. Blood test is done to detect the eosinophil amount of the count of the eosinophil, which is increased in asthma. So these various tests, they are performed. Then we can perform sputum test, the flame test, and we detect there the uh, white WBC, especially the eosinophil count in the sputum or the flame.